My little list. So I'm back to ethics and massage. You got that there? All right. So here are some major issues, both internationally, nationally, all the way down to our own individual practice. And I'm going to, go through these fairly briefly, kind of give you a little bit of an understanding on what's going on. If one of these really speaks to you, and you go, oh, wow, it's like it really resonated with you, jot it down. That might be a point of where you would want to explore some more with it. So, um, these days I consider myself a tortoise. I'm moving a little slower, but I haven't lost my step. So, um, if we look at the massage therapy community globally, we lack a unified vision. If you ask people, well, what is massage? What is massage therapy? What what is the scope of practice? What can we do? What can't we do? What are the credentialing requirements in Europe versus the credentialing requirements in Australia, and all that. What if if you are a nurse, using that as an example, or an accountant, or a carpenter, there are expectations of what you should be able to do and what, is it, you say I'm a carpenter, people are going to get a pretty good picture of what that is, and it's relatively accurate. We don't have that with massage. We don't have that with ourselves. And if we don't have that within ourselves as a unified vision of who we are and what our professional identity is, how is that going to influence or affect all the way down to how do we build our own client base, let alone what credentialing, licensure, or specialization, or whatever is going to be. We don't have entry-level curriculum standards in the United States, and Canada has some in some areas, but not universally. And the thing that gets confusing is like Ontario, Canada has got pretty strict requirements in order to use the title registered massage therapist. But you can practice massage in Ontario. You just can't call it massage therapy. Or you can't call yourself a registered massage therapist. You could call yourself a body worker. And there's no oversight, there's no regulation. In Michigan, you can do reflexology. It's exempt from our licensing law. So that's a loophole that unlicensed practitioners can use. So there's been many attempts to have an entry-level standard. Um, the licensing exam, the NBLEX exam, um, de facto is sort of set what curriculum standards are, but that exam is so broad because it's trying to touch on a little bit of everything, that it makes it hard to narrow it down into a true entry level idea. So this is something we're grappling with. The other thing is a cohesive career pathway, you know, with Zoe mentioned that she's a certified nursing assistant, a CNA. There is a pathway if she wanted to do it. Same with EMT. Those credits can move to the next tier, and then the next tier, and then the next tier, and the next tier. Um, uh, we don't have that in massage therapy. We don't have formalized credentialing around specialization, like sports massage as a population-based thing, or prenatal massage, or condition stuff like oncology. There's people that are teaching classes, but there's no unified credentialing on any of that. Um, there is very little oversight on the role of continuing education or what is taught. Um, and so you want to be you want to be cautious. Uh, an area of problematic issues in continuing education is teaching outside of scope of practice, where you're learning things that may not be within the massage therapy scope of practice of your state. I mean, I did. I learned all kinds of stuff from athletic trainers and osteopathic physicians and chiropractors and all kinds of stuff. There's just all kinds of stuff that I do that's outside of a typical scope of practice for massage. So, um, most states require uh, continuing education for licensing renewal. Um, there's an underlying philosophy that the intent of this is to help people improve and stay compliant and professional in what they're doing. So, I mentioned specialization already. The the an ethical problem, not the only one in this, is that there is a difference between taking a class and getting a certificate and taking education and then passing a real board certification or a specialization exam that's offered by an independent body. Uh, we have board certification in the United States with the National Certification Board, but it's not targeting um, any type of specialization. So you can't be certified oncology massage therapist. You might have heard those terms. It doesn't exist. You can have a continuing education credential, but there's no certification. There's no certification in prenatal. There's no certification for sports massage. There is one for manual lymphatic drain, but it is uh, mostly for nurses and occupational therapists and that sort of thing through LANA, the Lymphatic Association of North America, I think is what that stands for. So, and then an undercurrent in a lot of this is we don't have unified terminology. I was just on a National Institutes of Health seminar where they're studying force-based um, manipulations because they're trying to understand the mechanisms of manual therapy and managing pain. And one of the things that came right to the surface is that we don't speak the same language. So how can a massage therapist using one set of terms communicate with a chiropractor who's using another set of terms, communicate with an acupuncturist who's using another set of terms? And how does that come together to support research and recommendations for non-pharmaceutical treatment of pain? So that language is an issue, and that's been one of my, soapboxes that I've been on. Uh, we've got enough research, I'm going to tell you that. We do, proving that pain and massage has value. Um, And most of the research that's coming out now are things called meta-analysis or systematic reviews, where they're looking at a lot of different research and then pulling it together to get a unifying sort of theme on it. Most of the research is not bearing out what I was teaching even 10 years ago, let alone 20 years ago. So one of the things that we have to is we have to stay up to date. We have to learn to unlearn. Just because something was or we thought it was, and then we learned that it isn't, means that we're doing what we thought was the best then, but now we know different. And so now we need to do different and need to speak different and we need to think different. This came up, autonomy, self-employed, employee. What are the pay structures? People who are thinking about becoming self-employed, many of them have very inflated ideas about what they're going to earn because they don't understand all of the costs behind the scenes. Many people go into an employment situation and they think they're underpaid because they also have not been taught everything that goes into the cost of running a business. And then what should be the fees for massage therapy, and what is the income structure, and what's going on with all of that. And a lot of people are struggling to make ends meet. It's a big topic. And then practice longevity, the burnout rate. That's that goes to poor ergonomics and body mechanics, and not understanding how much there is behind the scenes other than the draping and doing a gliding stroke or whatever. And I kind of go back up to entry-level education a little bit on not addressing these issues very succinctly. They kind of skirt around it a little bit. So, and then the ongoing problem with the illicit sex businesses and human trafficking. So, crawl that one up. There we go. So as you kind of think about those things I threw out there, and there could be others, if you come up with something, you know, um, then the question is it an ethical issue, or is it a lack of information, or is it both? And what am I supposed to do, especially when nobody has a rule, and do I have to follow the rule to the exact parameters of the rule, or is the rule kind of flexible, or this is where a lot of confusion comes into play. And again, I notice on social media, a lot of the questions that come out are people looking for either confirmation on a decision that they've made or ideas to help generate ideas on what they should do about something, from setting up their room to what their marketing would look like to what they would do with a client who doesn't show up for appointments or whatever. I mean, it's like there's a lack of community, there's a lack of connection on this kind of stuff. So, let me see if I can read this. There we go. In this seminar, we will focus on ethical standards for the massage therapist and this outcome of pain management. Topics of discussion include recognizing the nature of the client's reason for massage by clearly defining the problem and the outcome, collecting and analyzing information related to the client and their desired outcome from massage, evaluating information relative to the specifics of the client, and brainstorming potential interventions, drawing conclusions, making decisions, and then developing and monitoring an intervention plan. What a word salad. Okay, so one final slide here. Um, there, there is a way of looking at healthcare and massage in most state licenses. Massage therapy is licensed as a health occupation or a health in a category called health professions. That's the way we are in Michigan. And most other states have that sort of idea in it. At the same time, that's the same licensing definitions will then say we cannot diagnose or prescribe or specifically treat or, that is, I think a better word for that than health maintenance would be medical intervention or medical assessment. So there's this thing called salutogenesis. It's a spectrum of the healthcare concept. And on one extreme, it's a continuum. On one end, we've got self-care and using resources, including people, to help us maintain our well-being and health. And then on the other side of it, we've got where it's broken down. We're sick. Something's not working. And so that would then fall to this idea of medical treatment. And since this is a continuum, we can walk back and forth on this. And there is a substantial overlap in there. So one of the questions we have is how much does a massage therapist need to know if they're primarily working in the health well-being side of this? But those things that we do, like managing pain, can be very, very helpful and additive when somebody is going through a medical condition or trying to deal with like a surgical intervention or whatever. Where is that? Who do we need a special training? Is this where a specialization comes in? Is there a special certification for that? And you might have heard the term medical massage, which nobody knows what it is, and there is no credential for it. Um, so there's salutogenesis, which means everything is focused on moving towards well-being, and living in a healthy way. Now, you can still have a thing. I can still have a vision issue, which is a medical issue. It's glaucoma. I have that. It's treated. I've had surgeries and all that kind of stuff with it. It affects how I live my daily life. But I can still have quality of life and resilience and wellness and companionship and community and all that well-being. I can still have all of that along with monitoring and making sure that the vision is staying stable and all of that. We can't separate that. But massage doesn't know what its personal identity is, its professional identity is, and so it doesn't know how to walk that continuum. And I think that that's where a lot of ethical dilemmas will show up. Okay, so I threw a bunch of stuff out there, and we need to sort of narrow this down because there's a lot to talk about there, and we can't talk about it all. So I'm going to put you into, let's see, 1, 2, 3, 4, 5. I'm going to put you, this time I'm going to put you into two groups of four. And Mary and Ed, because you're got the most experience that runs around with this, I'm going to make sure that you're in one group, Ed, and you're in another group, Mary, and then the rest of you will end up where you fall. So it may take me a minute to get these breakout rooms set. Now, Mary, I don't know if you've ever done a breakout room or not on a
A little
Zoom.
bit of breakout rooms.
Okay, so
Yes,
you
I
know
have
you
done.
know how I'm gonna, there'll be a thing with the screen and you'll join
I
it.
press a button and then we'll
Yeah.
be in a little separate thing. So, yes.
You'll be good. Okay, so give me a minute and it is by the time I get you all set up and ready to go, it's going to be pretty close to 6:30 here.
Mhm.
So, wow, that went fast, didn't it? Um, so what I'm going to do is I'm going to give you 30 minutes for this round. And in this round, I want you to take 10 minutes of it. You can decide in your group. I want you to take 10 minutes of it and get up and walk around and get a drink of water and all that kind of stuff. So when you get into your groups, you can decide as a group, I need a break right now. Let's take the break and then we'll just come back in 10 minutes and then we'll discuss what we think are the most immediate concerns for ourselves right now. Or you can do that and then go for a break. So that'll be your decision-making process with all of this. So
And what
there's,
time do we need to be back?
well, at 6:30, I'm going to count this at 6:30. So I'm saying 7 o'clock.
Okay, thank you.
Yeah, 7 o'clock. So assign manually. All right. No, I don't want to do that. Sign on. Okay. D create. Whoop. Recreate. Okay. Ed. Oh, it did good. Okay. All right. So once you get into your rooms, it's going to be a little over a half hour. That's okay. We'll be back at 7. And what we're going to discuss is you'll want to have a spokesperson for the group, but what of that initial overview I gave you, what floated to the top for all of you? What is an issue that you think is extremely relevant? And discuss it amongst yourselves and then come up with one or two to share with the group. All right? Okay, here we go. There we go. Okay, I'm going to repeat that just a little bit, so because I did forget. So, as we take a look at how we interact with others, and we move into our broad scope of practice, we really do have a very broad scope of practice when we look at other health professions. Um, we we learn our skills in entry level training, and then we can refine them and we can expand on them a little bit. But most of your continuing education is not about what you do. It's about who you do it with and how you interact with the other treatments and care they're getting. So, if Mary were doing something with occupational therapy, she was um, teaching, somebody how to use their hands after a stroke or something like that, right? I would want to make sure that we collaborated before I just went ahead and did something that would change the tone pattern, because that could change the grip. And so it's about how you are going to work together and collaborate. And that collaboration doesn't that can be where it individual practices, but you've got to learn to communicate. So when you're choosing your continuing education, it's not so much about the method. It's about learning more about the individual, the other things that they might be involved with, because the complexity increases as you go across the spectrum as well. The assumption in a post entry level training is that the people are generally well and they got the occasional ache or pain or something like that, or they're not sleeping, or they've had a stressful day or whatever. Most of our clients are going to be here in this middle area where their feelings, symptoms, they're anxious, they can tell they're stressed, that kind of stuff. And it depends on how far into that, whether or not are in a situation where we need to refer and say, I, I need to understand that you are also getting help in other places on that, and then we can work together, and we can collaborate around all of that. So, the other thing is that the clients these days are buying outcomes. They're paying for outcomes. They're not, and some of that outcome is the experience, the going into a pleasant environment, the quiet, the warmth, all of that kind of stuff that makes for a pleasurable, well-being focused massage. And that is an important part of what we offer that nobody else offers. In addition to that, though, in order to justify that they are spending their money wisely or whatever, they're usually going to have a thing. My shoulder is this, or I can't, bend over and do that. And they're going to want a result on that, they're going to want to know that you hear them and that you pay attention to them. Um, but the idea that they want you to fix them, we got to be really careful with that. It doesn't mean that somebody who has a very complex set of circumstances can't increase their quality of life, but at that point, it's going to take more than massage. And I think you're going to see a lot of variations on a wellness center type environment or an interdisciplinary network. A model for that, there's two models for that. Hospice is one. The other one that's been fairly progressive with that is oncology, where they're especially like cancer treatment centers. And I think that is evolving into pain centers where they're using a multidisciplinary approach to, psychology and occupational therapy and nutrition and massage and medication and all that kind of stuff in combination. And the model for that is currently the whole health program in the VA system, the Veterans Administration system, which is inclusive of all of that, but they're having problems with funding. So I'm concerned that they're going to cut funding for that program. So but you can find that by just searching for Veterans Administration Whole Health Program, and you can see how they are working with that interdisciplinary process. And they actually have a job description for massage therapists and a pay scale and all that kind of stuff. So that's kind of cool. So here are outcomes that are evidence informed. And this multiple approaches, methods, modalities can address these. The thing I want to impress on you is that the full body general approach is the one thing that we do that nobody else does, that focuses on well-being and feeling better. And that is going to influence stress management and pain management. So I see people learning more stuff to do, and so they do more stuff, but they forget to do the massage. The general massage is where almost all of the benefits come from, with a variation in pressure and that sort of thing. So this is a question we're going to come back to here in a minute. How does this content influence career practice models, specialization, and business practices? And then I also wanted to point out that where you are on your career journey is going to make a difference as well. So I've got some novices in the class. I've got, there's Elizabeth and there's Kate, and then I've got some advanced beginners, that after they get out there in the real world for about a year, they're going to graduate here in April. And once they get out there and do about 1,000 more massages, they'll feel pretty competent. But it doesn't happen overnight, and then, after you get that first couple of years, first couple, 3,000 massages under your belt, then you're going to start to feel more comfortable in your skin with this. And you don't just become an expert. You work at that. It takes time, it takes mentors, it takes mistakes, it takes fixing your mistakes, it takes all of that to move through this. So, but don't be discouraged. Don't try to be an expert when you're an advanced beginner. Honor where you're at and then have a plan of moving forward with it. People get themselves, I think, into ethical dilemmas when they try to work at a level here that they're not quite ready for. Does that make sense? Um, so just a tad more on the pain part of this. There are two types of pain in this world: pain that hurts you and pain that changes you. So acute pain is what protects us. It tells us that we're in danger. Um, that is good pain, and it does hurt, and we can hurt emotionally, we can hurt spiritually, we can hurt physically. Um, and it helps us move through unless we get stuck in it. And then we're just stuck, and we no longer have the thing in place that is hurting us. We don't have the surgical issue anymore. It's healed. We don't have the bad job environment because we've taken an action and we've left it. We have had our heart broken because we've lost a pet who's been as much a part of us as anything, and there's a space that's left open with that, but we can go through a grieving process, and that's when we start to use that pain that changes us. And this is not easy. This is hard, and it is something that is trying to be addressed in this multidisciplinary environment to help people with chronic pain as opposed to giving medication. But there is a time and place for medication. Opiate-based medication is fantastic for acute pain for a short duration. In fact, there are studies that show that if acute pain is not treated aggressively within the first few days, it has more of a chance of becoming centrally sensitized, which means that the pain memory lingers and continues. And I can reflect on that with the heart surgery, the open heart surgery. That hurt now, doggone it. they cut your chest open and I'm alive and I'm not going to complain about it, but that hurt. And I liked it when they gave me my opium shot, my Demerol. I was, but it reached a point that it, it wasn't addressing the pain in the same way. It happened in about a week. And it was making me feel weird. And so that I was able to make that transition. But if somebody doesn't have the support system or the knowledge base or the expertise to make that transition, then that can linger. And then it's complicated and it's not something that you really want to manage on your own because that's when people get clingy. That's when they think that you're the only person that can help them. That's when they think that, you are their savior, because their headache can go away for a day or whatever. And when you're really good at what you do, that can happen. Ed, have you got something on that?
Um,
You popped up. So,
did I? Oh, okay. No, I didn't. I was just listening.
okay. All right. And then I don't ever want to do a class on pain when I don't bring to your attention these viscerally referred pain patterns. This is where some sort of organ function or dysfunction is referring out into what feels to the person like a musculoskeletal thing. Choke. So the classic one that we know about is that isn't always there, by the way, but it's the pain in the left um, arm and chest and shoulder for a heart attack or a heart problem. But people that have uh, lower flank pain, that could be a kidney issue. Um, they have issues that are distributed across the low back. That can be ovarian, or it can be urinary bladder if it's more focused. Gallbladder and liver stuff can go up into your shoulder, just like lung problems can go up into your shoulder. So you can get this diagram in a lot of different places. And so you want to make sure that if if people have, persistent pain that they can't kind of move away from, because if it's somatic, if I've got a pinched nerve or something up in my neck, I can usually wiggle my way away from that. So I can get, it's called a relieving, there's aggravating and relieving factors. It's visceral. You can't wiggle away from it. It's just there. It's a constant sort of, and it's not like something that's going to punch at you either. It's a nag. Um, and so just, I always want to bring this to people's attention. The worst that's going to happen is you're going to refer them and say, you've had this distribution of stiffness and aching across your low back for a long time here, and it kind of goes into the front. It might be worthwhile to have your physician check that out and see what's going on. That's classic for kidney and urinary bladder problems. And especially with older people, they can, um, a bladder infection or a kidney infection is very serious for that. And then Ed, your dad, if I remember right, was having some low back stuff. You recall that? And he went to a chiropractor
Yeah,
and it ended up being bone cancer.
right. Yeah. Well, unfortunately, the chiropractor didn't take any X-rays or anything. He just
Right.
popped on his low back, and he just the spine was already he had cancer, and it was already pinching nerves, and he just got the spine to the point where he just had severe pain after that.
Yeah.
But yeah,
Yeah,
it could, yeah, like you said, it can be hiding, pain can be hiding other things.
this spot between the shoulder blades could actually be something with the stomach or a hiatal hernia type of a thing with acid reflux. Um, and when I had heart symptoms, but they acted a lot like acid reflux. And so they were checking me, they were doing a heart cath just to rule it out because they wanted to make sure that I was getting treated correctly and they were going to send me to a gastrointestinal person. And it was almost a full block in the left main. I was a walking time bomb kind of a thing. Um, but I kind of had symptoms more in my back than when I look back in retrospect. I don't, so that was a little confusing when I think about it. And right down the middle of my chest, I never had anything that went down my arm. So, just a heads up. And then the other thing is, I want to talk to you just a minute about the idea of counter irritation. Most of what we do with massage is this. And the chronic naggy pain usually runs on A nerve fibers. And if we can stimulate the C fibers, or other way around, runs on C fibers. If we can stimulate the A fibers with novel sensation, that the nervous system is going to ignore whatever is nagging that person for a while. So this is a picture here of using cupping or whatever, but when we rub something, when we move something, when we twist something, we are sending a novel, different sensation into that person's system. It's got to process that, and it's going to ignore the thing that's nagging them for a while. And that's a really important thing that we do. And if it can give them a couple, 3 days worth of relief, that's a lot. And if they can use things like hot and cold and some stretching and to extend that relief over a joint aching or a stiffness in their low back or a knee that's bothering them, then that's good. That's a good thing that we do. And then we need to know when not to. Well, that's a gut response too. If you're feeling uncertain, when your gut is telling you this needs to be changed, I don't, even when they're asking you, can't you just work a little longer, a little harder on this spot? You know, yeah, you're in charge of what goes on there.